Let's take a look at a management of your patient who has stable angina, acute coronary syndrome. Let's go back to quickly our discussion. If it's stable, exertion, angina, pain. If it's acute coronary syndrome, then the plaque has gotten so big that the pain is going to be at rest. Myocardial infarction, acute, we walk through in great detail in our previous lectures. What is the two immediate goal? This goes back to that physiology that we talked about, where we are addressing the demand and we're addressing the supply. Now, what do you want to do? Well, if you know that your heart is compromised due to whatever reason, in this case it's atherosclerosis, then would it make sense to try to decrease the demand of the heart? So therefore, what kind of receptor does the heart have in which its activity is pretty much controlled or influenced? Beta, right? Beta 1 receptor. So why not try to control the beta receptors? Why not administer some calcium channel blockers? Right? So those are things that you're paying attention to. Now, be careful, though, because if you administer too much or if you have your patient going into massive MI, then the heart has no chance of recovering. You're going to kill your patient, so be careful when you're giving such drugs. Or what about the supply? Well, when you know that the supply has already been compromised, why not try to get in there and try to remove that clot? And by doing so, aren't you addressing both goals?